Hey everyone, Harrison Reed here. Today I want to talk to you about rejection. It's something that we fear in our personal lives, and it's something that we fear when it comes down to our academic writing. Now, the number one reason for rejection is something that we don't even talk about. I've done research on this topic before, and I've published articles about the most common reasons papers get rejected from medical journals. But the truth is, a lot of that research and a lot of those articles ignore the number one reason for rejection from medical journals and other academic journals. The number one reason for rejection is never submitting in the first place. And look, this isn't a trick. I didn't mean to make this all clickbaity, so keep with me here. I want to talk to you about that idea of self-rejection, the idea that never getting started in the first place is the only way to guarantee that you won't be accepted to a medical journal. And I want to talk to you about how to overcome that, why that fear should not be as pronounced as it is, why that shouldn't be as intimidating of a process as it is, especially for new authors, especially for new writers. Okay, so stick with me and we're going to break this down. Let's talk about how we are going to overcome this self-rejection that we often do to ourselves. This idea that we shouldn't even bother because the task is too great, it's too intimidating, the chances of acceptance are too low. There's a few concepts that I need to teach you about the academic writing world so that you can realize that, in fact, your chances are so much better than you think. One of the first things you need to know is that doubt that you feel, everyone feels it. In fact, that doubt is actually limiting the amount of competition that you face. Now, if you think about things like really competitive processes like medical school applications, right? Everybody's trying to get into medical school. Do you know what the medical schools with the lowest acceptance rates are? Yeah, it might surprise you. Last year, the medical school with the lowest acceptance rate was Florida State University. Yeah, it's not one of the Ivy Leagues. In fact, if you look at the top 10, none of the Ivies are on there. Everyone believes they can get into Florida State. Everyone believes they can get into George Washington University and Howard, a couple of universities that are in my city here in DC that are also on that top 10 list of lowest acceptance rates. Because everyone believes they can get into those schools, they flood with applications. Meanwhile, the quote-unquote top-tier schools out there often have fewer applications and a higher acceptance rate. So statistically, it's easier to get into Harvard Medical School than Florida State. The same thing happens with medical journals, by the way. If you look at the acceptance rates to top-tier journals versus smaller, maybe more niche journals, maybe journals that don't have as much clout, you'll see that they have similar rejection rates across the board. Why is that? Well, it's because people don't believe they can get into the top journals, so they never submit something in the first place. People who are doubting themselves make your job much easier. There's all kinds of people who might be more experienced or have done a more sophisticated study than you, and they are never going to ever be competing against you because they won't submit. But guess what? You will. So you're going to find yourself in a much thinner field of competition than you ever thought. In fact, you have nothing to lose by shooting for a better journal, getting rejected, and moving on. So there's really no downside to stepping up a level of competition, so to speak, and seeing if it's really as crowded of a space as you think it is. The truth is you're going to be a lot lonelier the higher up you go along the echelon of medical journals. So take a shot. For the most part, you have nothing to lose. Okay, the next concept you need to know is about the scarcity curve. Scarcity is just this idea that there's not enough and there's too many of us. Whatever it is, money, jobs, food, dating, whatever you think out there is just limited opportunities and too many people shooting for those opportunities. Well, this is the thing about academic writing. That scarcity curve is actually kind of backwards. It's flipped to the reality that you think it is. The scarcity is not journals and opportunities to publish. The scarcity is good academic work. The scarcity is you, an author who has put together a well-polished piece of writing or research or whatever and is submitting it to the journal. Remember, these journals are out here looking for the best stuff. They're always looking for the next article, the better article, the article that's going to fill their schedule months down the line. When we're editing journals, we're looking for something that's going to be filling our pages 6 months, a year from now. If we can keep really ahead of schedule, we're happy. So we're hungry for more submissions. We're hungry for more content to put into the journals. We would rather have a stockpile of good articles than be searching last minute to try to fill our pages. Remember, you're providing excellent, expert, free labor to journals. You can act like you have a little bit of leverage. Now, it doesn't mean be rude and cocky. It doesn't mean be entitled and make demands. But what it means is you can feel confident walking into a situation knowing that that journal needs you a lot more than you need it. You, as an author who's put in their expertise, their passion into a project, that's gold. That's what everyone's rushing for, not the acceptance letter. The acceptance letter is what they're using to buy that from you. The next thing you need to know about academic writing and publication is that it's not about performance. I know that sounds weird, but stick with me. Pretty much everything in your life probably comes down to your performance. Your job, if you're still clinical or if you work in a clinical job, it matters how you perform every day, right? You show up to work, you have to see X amount of patients, you have to make sure you ask the right questions, you have to make sure you do the right exam maneuvers, you have to send the right test, you have to follow up. Maybe you're in critical care like me and you have to make timely decisions and resuscitate your patient in a very competent manner because the time is ticking. It doesn't matter what you did before you woke up that morning. It didn't matter what you did 5 years ago. If you don't perform every day, then you're not doing a good job. It's different in academia, in academic writing. It is about the product. Meaning it doesn't matter if you wake up and have an off day of writing. You can fix that. You can go back and edit it. It doesn't matter if you wake up and you're not the best researcher in the world. You can team up with someone who has better research skills. It doesn't matter if you're not the best at statistical analysis. You can learn more about it. You can find someone and bring a teammate on board or a mentor on board to help you with those deficiencies. And you can take as much time as you need to do that. You can try it as many times as you need to. You can polish this product over and over and over again until it looks like something that no one could have possibly ever done on first attempt, because guess what? No one can do it on first attempt. You are supposed to be refining your work as you go along. So take some of that pressure off of you. It's not really about your ability. It's about how much hard work you're willing to put into the process so that your product is better than any single day's performance you could have possibly had. So keep that in mind when you're thinking about your own abilities, your own shortcomings, your own limitations. You can chip away at this thing. It's a long-term project that's going to produce a product. It's not about performance. We need to remind ourselves that rejection is not final. Rejection is part of the process moving forward. You're allowed to accumulate rejections for even the same manuscript over and over and over again. It doesn't mean that manuscript is inferior. It might just mean it's not the right fit, or there was something about it that got a rejection from one particular editor. That's not an indictment of your abilities, your knowledge, who you are, or even that project or that product itself. What it means is you need to keep pushing forward. Rejection is an opportunity to look for the next place to submit, but it's also an opportunity to sit back and reevaluate your work and probably get feedback along the way. The great part of the peer review process is that you usually get very specific and often expert level feedback just for having submitted. Sometimes you'll get a generic rejection letter that doesn't really add much, but for the most part, you're going to be learning as you go and finding ways to improve your work. So rejection is an excellent tool. It's not something that's a sign of failure. It's a sign that you can continue to move forward. So it's okay to rack up rejections. I get my work rejected all the time. In fact, many of the things that I've published have been rejected once or twice or 10 times before they ever reached publication. Don't overthink rejection. Don't fear it. Look for it. Find ways that you can go out into the world and greet rejection head on. That's a good sign. That means you're trying. Remember, you're allowed to submit a manuscript as many times to as many different journals as you want. There is nothing that says it's dead in the water. Once you've been rejected about 100 times or 1,000 times like I have, you stop fearing it, you start looking forward to those rejections so that you can learn from them, and you just pick yourself up and keep going. All right, I hope this video was useful for you. Listen, you don't need to be afraid of rejection. Go out there and do it. You can get this done. And in fact, I want to see if you can go out and earn yourself a rejection. That means that you didn't self-reject. It means you got out there and you racked up a rejection. You're gonna need to do that as an author. You're gonna need to do that as an academic. You're gonna need to have a lot of rejections under your belt. So if you've never been rejected by a medical journal, go out and get rejected right now. If you've been rejected lately, leave a comment. I want to hear about the biggest journal you submitted to and got that rejection. I submitted something to JAMA recently and got rejected within a couple of days. I love it. Reject me fast if you're going to reject me, okay? I don't want to have to wait all day for that rejection. That's exactly why I submitted it, because I knew they'd get back to me fast. I'm looking for that next acceptance, but I'm going to get some rejections along the way, and I'm okay with that. If this video was useful for you, make sure you're subscribed to the channel so that you can get additional writing help and publication insights. Make sure you go to harrisonreedwriting.com. I have a great guide there to get you started on that first article that might not get rejected. It's going to help you refine a idea and really focus it. It's called the First 5 Steps. So download that guide. You'll get on my mailing list. I'll be able to keep sending you more helpful writing advice. Subscribe to the channel, like this video, and share it if this was helpful. We want to help everyone get published. So thanks so much for watching. I'll catch you next time.